The Center for Advocacy and Research is a not-for-profit organization, and our main work is with urban poor communities who live in informal slums. When I say informal, we are talking of the most marginalized people living in slums without basic resources, without facilities, without schemes. And CFAR works across 8 states, Delhi included, and in all cities we work with government partners and stakeholders. Because we do believe that the responsibility eventually is the government, but the service delivery model has to be created by communities and government together. So that is, primarily our work. And in informal settlements, we work with a lot of, we especially work with a lot of excluded communities, which includes your unorganized workers, so domestic workers, sex workers, trans people, persons with disabilities, girls, women, socially marginalized groups, sanitary workers. So a lot of groups who otherwise are, on the margins of cities. So that's basically what we are doing. I wouldn't take the credit for CFAR establishing it, because you see, the Coordinated Relief Network was established by a group of organizations. So because we were all in this together, when the pandemic happened and we realized that the urban poor was not getting enough food, enough scheme, enough health supplies, what we did was we decided that it's a time for all of us to come together, and the Delhi government had created a food monitoring committee, if you remember, and some of our team members were a part of that committee. So, and that committee was supposed to be delivering the supply from the government to the last mile, to the poor. And we decided that the Delhi being a big city with 11 districts and with I think 33 million population, it was not possible for us to reach everybody. So what we decided to do was that if there is a network of organizations who are working with informal slums, then we will be able to reach more people and more easily. And the roads were closed, that there was no transport. We also don't have money to spend on a network like other corporate organizations. So the CSO networks joined together, and there might be, I think there were 4 or 5 groups: SEVA, IIHS, CFAR, and I think Basti Vikas Manch, Jan Pehel, Action India. Some of the groups were leading, but they were only there because their face was there. There were many other networks. I mean, I don't even know the count of how many people were there, but there was this, networks after networks who were joining us.
And what was your role particularly with
I was coordinating the network. And as CFAR, and also as, because you see, the funds were distributed through CFAR because it involved funding by donor partners. So they had given the money to CFAR, we were disbursing the money, we were managing, and so I was coordinating that entire operation. You are talking of only 76,000 kids. I think the network distributed much more, because you see, 76,000 kids were the ones which were given by the government partners and some other partners, but there were a lot of kids which were coming from other CSR sources, even from own CSO partners. So this entire operation was managed at the financial level by CFAR. So we did something very basic. We developed processes for how we will do that. So we were not giving grants to organizations. We were asking them to identify vendors. In every localized areas, we had identified vendors. Those vendors would give us a GST bill, which is as per the income tax and the statutory laws of the country, and those would be reimbursed. And the organization which was taking those kits from, as part of the network, would take the responsibility of verification, identification, making sure the quality of grain was good, also ensuring that it reaches to the person it is assigned for. So all this operation, and we did not disperse anything in cash. I don't remember giving a single rupee in cash, because everything was done through bank transfer, because it's best to be, because you are taking money and you're working with a host of organizations, and principally also it's best to be as transparent as possible. So we streamlined a lot, and the finance team of Center for Advocacy and Research and the program team and and some point persons from the network work together to make it happen. Many learnings. One is that the program team should know accounts also because that is something what happened, and the account should know a program, because you see that coordination is very important, because sometimes you do get involved in bureaucracies and procedures and you're not able to deliver. So there has to be a midway. Well, that is a learning for, a very basic learning. But one of the learnings is that from the first phase and the second phase, in the first phase, CFAR did a lot of, relief distribution also in the first phase, but we did not have a network to support the work. So we have community management committees in every slum where we worked. And they were the ones who are our eyes, ears and distributors on the ground. They would go to households, line list people, identify who needs it, send us a request. The CFAR line facilitators, who are our field team members, would send us the request, and we would buy the kits and give it to them and then distribute it thereafter. In the second phase, what happened was there were many organizations. We were able to reach much more, many people, and strangely enough, despite working on the slums, many of us did not know the kinds of people who were living. We thought that you have some basic categories in slum, but there were hidden pockets in the slums who were not on any list or any sort of database. So we decided to also reach out to them. So you were able to get a deeper penetration into the work you were doing. Secondly, the network, I think, came together to manage the disaster, because the government was giving a supply of grains. They did not have a network to manage it. And I think the complementarity of the supply and the network helped us to reach the last person, which we otherwise would not have. So that is one major learning. And the learning from this is that you have to sustain such networks. You have to have a local mechanism at the ground level, at the community level, which is led by the community. And the government has to work with those governance structures to actually ensure that there is a last mile delivery. It's so true for all the schemes also. You have a scheme which is very good, but people don't get that scheme because they don't know where to apply, who to go to. Similarly, the government doesn't know the poor. They don't know who needs that scheme. So that marriage has to happen, and that can only be happening if you have a governance structure at the ward level, which filters down to the community level. So that participatory approach has to be so governance mechanisms, and especially in a city like Delhi, you have to have a mechanism which governs the systems, and there is no system, which is very sad. So for next disaster, shouldn't happen. If it happens, we must have a structure which is there to deliver it, because organizations like CFAR or IIHS today are working in Delhi, tomorrow might be working somewhere else, or might not work, or decide to wind up some things and do something else, but that those networks will remain, because the community will always remain in the city. So that is something which I feel is very critical. We are very statutory norm and compliance oriented, because we have to ensure that whatever money comes for the poor gets to the poor and is accounted for in a transparent fashion. Networks do not, I don't know if they can get money directly. Some of them do get money directly, but they would also do the same thing. So I think the entire structure of compliances is true for all of them, but CBOs don't necessarily get big money to for relief. They will get kits in kind. They will get it through facilitating networks and organizations like ours. So that is the difference in that makes it, because they also, a lot of activist work, mode work is done. They can demand. We do not believe in creating a demand and fighting or struggling for things. We believe in shaping the service. So that is the difference in the approach which CFAR follows. We are saying that we are not demanding it as a right, because the government does not, everything that the government doesn't need to do. Both of us do it together, and then we shape how we want that service or that scheme or that mode of delivery. So that is the difference. But the informal networks also get formed in times of crisis. I know that there were many groups coming together to reach. For example, I still remember I used to get this call from a railway station where there was this young coolie who was working as a labor, and he used to call me and he used to tell me that, ma'am, we need relief because there are a lot of people here. So one day I asked him, I said, why are you doing it? He said, because there are people here, you're not getting anything. And even the union of the railways, or they are not getting support from anywhere, and they had come to this network. So I said, but we don't know those people, how will we do it? So he created his own informal network in the station, where there were 70 people who were helping us distribute relief. So we would send it to him and he would. Now the question is, how do you verify such people? So you physically go there and verify it. You ensure that there are 70 people who are working and they are reaching out another 1,000 or 200, 1,200 people. So you do go and physically verify, but the fact that it was decentralized in its operation was what works. So that is the difference between a lot of
Yeah.
So we believe that decentralization is the answer for any of these issues. I think what we did was, I know that while we were doing relief, we also had people in the network who were doing the health services. So if there was a need for an oxygen cylinder, we knew whom to reach out to. So it was not sent to everybody. We had specific. So this was like a focused intervention. So if you need oxygen, you go to X number of people. I know there was this young girl who was coordinating it, and I used to call her every time we needed a cylinder, and she would coordinate with the community and deliver it. Besides this, I also know that there were many other public health centers, there were many other CSR groups who were doing that. There were also RWA colonies who were doing distribution. So I think at that time the crisis was so intense that across networks, across CSOs, people were coming together. So I mean, you could call up any random person whom you might not have met, and you get a number and you call up those people and say, we need an oxygen cylinder, and they would call other people. So there was also a group which was created where people were writing up their demands for oxygen cylinders, medical beds, equipment, or even for ambulance services, or even for permission to secure the body and dispose it with dignity, even that kind of services. So I think the network played a very important role in identifying some people who could take charge of that while we were focusing on relief. But some of the organizations had to do both because of the nature of the work we are in. So if we are doing work with the communities, we were also working on issues of violence. So if there is a cylinder at home, and if a woman is ill and if a man is ill, the priority would be given to the man at times. But we ensured that such, and if it's a household which is a socially marginalized household, it might not necessarily reach that person. So we were trying to also balance many other issues during this period. But the separate network which was created for health services helped us. The first phase also, we had relied on the community to line list people, identify a household. The quantum of grain was less that time. We also found that if you give one bag of say grain to the community, and there are 4 people, they will actually pool everything, divide it and subdivide it, and then ensure that everybody gets a small share. So one of our learnings from this phase was that we have to rely on the ground. The second learning was that, like I have already said earlier, that partnerships work, networks work. And the third, sort of learning from this phase is that even the government does not know who to reach, how to reach, where to reach. So while you are supporting the community, while you are supporting the poor, while you are supporting CSOs, you also need to support government to ensure that they are able to reach people, because they are also trying and we are also trying. So somewhere you need to ensure that you also empower the government and work with them so that they can complete their last mile delivery. So the government can take by sustaining these networks, working with the communities, strengthening ward level and in Delhi maybe district level governance, because the local self-government is not existing in Delhi. We have political representatives, and we have in some places we have maybe I don't, in slums you don't have it, but you have these self-appointed pradhans and elders. It should be such that informal committees which are set up in slums are formalized into the governance of the system, into the local governance, so that decentralization, which is also said, the 74th Amendment also says that you should have local self-government. So basically, if the government decides to formalize these structures and strengthen the local self-government, then decentralization will happen. So then you won't need a network of NGOs to take that role. It will be self-sustaining. It will be in an auto mode where the communities will take it forward with the government, and then the government we can all of us can work on, say, documenting learnings, to all in doing paperwork, creating databases, writing up case stories, showing what we are able to do. If there is a partnership like this, we can focus on other things. So everybody has a salient role then. So the government has to ensure that there is a mechanism for service delivery, and that can only come with the local self-government, and when you have a system of governance established in place. So that is something the government should really, and we have seen very good examples happening in states of Orissa, states of Jaipur, states of Karnataka. We can learn from the best practices, and Delhi can do its own model in that sense. I think once the unlockdown happened and people started getting back to work, because the major portion of deaths had happened, people had sort of healed themselves, and the compulsion of getting back to work was there. So if I'm not mistaken, I don't honestly, I don't remember the date, because some requests kept coming to us. And when requests kept coming to us, we started, then directing them to government systems, which is to the PDS shops. We also, approached. I remember that in the last phase, we got a request for 2,000 kits for sanitary workers, and this was across 15 states. We had no money because the relief money had finished. All the 3 tranches which we had got from the donors had completely sort of been exhausted. But the request came, and we didn't want to turn it down. So what we did was we rewrote a proposal and applied for another grant of funds. We were able to provide relief to 2,000 sanitary workers through that, and it had come from a South Asian network of sanitary workers, because the network's claims, and we also got to hear in the public hearings we did with them, that not a single food relief had reached the sanitary workers in many states. We did serve a lot of sanitary workers in the states where we were working, and we were in 22 states that time. But somehow people, every time you might go everywhere, but some people still get left out. So we were able to use this network and then sort of serve them. So we did raise funds. Then donor money also stopped coming. They started, money started stopping for relief, but they started giving money for development grants. So for maybe livelihood support, for water sanitation, hygiene support, for projects on social inclusion, projects on media, advocacy on health and reproductive rights. So all this was happening. But what we also did at this phase was we started empowering the self-help groups and the community structures which were created to begin some kind of livelihood, not very successfully. But we started doing something like that to manage those demands, but the funds stopped coming. And in fact, funds started also coming for infrastructure, say setting up hand washing stations or setting up incinerators for menstrual pads. So such, demand. So the focus completely shifted, because the solidarity funds were now one, and then people started doing research studies on what is the impact of COVID. I think this was a phenomena which was world over, not only in India. So all this happened, and once the funds stopped, demands kept coming to us, whatever little we were able to do. We also, CFAR also made another effort. We set up an online crowdfunding fund, with the help of one of our partners, donor partners who was working. And because money was coming for vaccination, if you remember, money had started, food, instead of food, vaccination was being prioritized, because the Prime Minister of the country had also started this entire campaign on 100% vaccination. So because money was coming, we started we did three major things. One is we started doing this crowdfunding. So a lot of people, friends, well-wishers, families started donating money. We used that money to serve people who were coming to us. That was the first thing. The second thing we did was, when we were writing up proposals for vaccination and support for vaccination, we would say that when you are giving a health service, there are also most marginalized people who need some kind of a nutrition supplement. So we started in building within those proposals some requests for food relief, but we were not giving it to 100% people. We were giving it to a prioritized group of people who were the most at risk. This was the second thing we do. And the third thing what we did was, besides keto funding, we strengthened the entire delivery of livelihood and putting people in jobs, skilling them, linking them up to the National Urban Livelihood Missions. Also in Odisha under the Urban Wage Employment Scheme. So there were many schemes which were coming. We started doing that. And some amount of financial assistance which was coming to people from the schemes which the government had started during COVID was also received by them. So maybe that helped a little. But majorly these are the 3 or 4 things which we started to do. You see, the network was never established only because of relief. The network, we are all partners, because all the development partners, all the CSOs, most of them who were a part of that relief committee, as we called it, relief coordinating body, are partners who are working on other host of development issues. For example, SEWA works on livelihood, Action India works on health and empowerment of women, IIHS works on housing and rights of slum communities. CFAR works on water sanitation, hygiene, social inclusion. Jan Pehle is working with hawkers. So that there are many networks who work and organizations which work on other range of development issues. So we came together to do relief, and we were simultaneously, we had taken, the other work had taken a back seat, because at that time health and food was the main priority. We gradually went back to our own works, but the network was still there. So you might not have a WhatsApp group, and it is, or even if you have one, it might be dormant, but we are connecting on other issues. And strangely enough, and very happily I am saying that many new partnerships were established. We are now working with people whom we had not worked earlier, because you got to know them through the relief and through the entire vaccination intervention which was happening that time. So you connect on lots of issues. You might not connect with all the 70 or 80 networks you were working it. You might connect with 2 or 3. For example, we are now working on another project where we are setting up workers centers. So all that. So similarly, I'm sure there are other networks who are working on a host of other issues. So when you build a network of partners which is related to development, I think at any point of time different issues get prioritized. So if it is relief at one point, and then it was vaccination, and today it is maybe livelihood or social inclusion. One thing which I think the networks now need to do, and that I've been saying at many meetings, is that we in a city like Delhi, the scale of the city is so vast, the types of levels of people and different diversity is huge. We should all be preparing how to cope with disasters, because we are not disaster ready. The city is not disaster ready. So last year before last, it was COVID. It might be something else tomorrow. What is our own preparation? So every time there is a calamity or a disaster, we don't have to run and sort of try to create a network. Again, the civil society and the government will come together, do bits and pieces. To sustain it, we should be disaster ready. And again, it brings back to what you and I have been discussing across, that there should be a mechanism for governance. Because unless that is established, if that mechanism is established where the government, civil society, communities work together, then whether it is a disaster, whether it is development, whether it is relief or health or any issue for that matter, we can all work together on it. So I think the ask is that there should be a system which is established so that everything gets decentralized. You cannot work in a centralized mode in these difficult times these days. And there are examples in other countries which are showing us that decentralized models always work. In terms of water, you've seen in states like Rajasthan, all the decentralized models are working. The moment you centralize things, then one or two people or one or two organizations or one or two governments become responsible for it. The model has to be decentralized and people centered.